Seizure medication review. Any medication can cause an allergic reaction, but dermatological problems, including rashes, are not uncommon. Life-threatening reactions such as Stevens-Johnson syndrome can occur. It is important to teach patients to report any suspected reactions to their physicians. When medications are to be discontinued, it is always recommended that they be slowly tapered down in dose strength because an abrupt withdrawal can produce seizures. Kidney and liver function testing should be performed to evaluate the ability of these organs to metabolize the medications. Some drugs will require changing the dosing if function is impaired. Meds that are metabolized through the renal system, like Gabapentin, levetiracetam, Topiramate, Succinimide. Through hepatic metabolism, Carbamazepine, Hydantoins, Valproic Acid. Watch for suicidal tendencies with levetiracetam, Topiramate, and Vigabatrin. Osteoporosis, especially look with phenytoin, carbamazepine, phenobarbital, and valproic acid. Consider checking bone mineral density after 5 years. The elderly, medications that they could take that would be safer are gabapentin, lamotrigine, and levetiracetam. Probably not Oxcarbazepine, phenytoin, and carbamazepine. Benzodiazepines may enhance the inhibitory effects of GABA and postsynaptic clefts between nerve cells. It is indicated for acute convulsive seizures and for status epilepticus. It is given in repeat doses, then followed by a long-acting anticonvulsant such as phenytoin. Diazepam is a drug of choice for status epilepticus and must be given intravenously slowly. Do not mix with other medications. Carbamazepine blocks the reuptake of norepinephrine, decreases release of norepinephrine and the rate of dopamine and GABA turnover, used in combination with other anticonvulsants to control tonic-clonic seizures and partial seizures. Not effective for myoclonic or absent seizures. Carbamazepine may rarely cause blood problems like aplastic anemia or agranulocytosis. Contraindicated in bone marrow depression and in patients on MAOI inhibitors. MAOIs must be discontinued at least 14 days before starting with carbamazepine. This drug should not be given with grapefruit, as the levels could increase. Teach the patient to contact the physician if they develop red, swollen, blistered, or peeling skin with or without fever. It has also been useful in treating trigeminal neuralgia and bipolar disorder. It works to treat trigeminal neuralgia by altering nerve impulses in certain facial nerves, which relieve the pain. Gabapentin does not appear to enhance GABA, used in combination with other anticonvulsants to control partial seizures. Also used for pain reduction, shingles, peripheral neuropathy, and nerve pain. This medication is eliminated by the kidneys. Adverse effects: dizziness, drowsiness, fatigue, loss of muscle coordination, tremors, nausea and vomiting, gingivitis, and pruritus. Hydantoins are anticonvulsants used to control tonic-clonic seizures. Phenytoin must be administered slowly. Do not mix with other medications in the same syringe. Dilute only with 0.9 normal saline to avoid precipitation. Infuse slowly, no more than 50 milligrams per minute. Do not give with warfarin, and cardiac monitoring is appropriate during a dilantin or phenytoin infusion. Toxicity may cause nystagmus, and infiltration causes sloughing of the tissue. Do not use phenytoin if the patient has an abnormally slow heartbeat or certain types of irregular heartbeat, like heart block or Adams-Stokes syndrome. Phosphenotoin works by slowing abnormal nerve impulses in the brain that cause seizures. IM phosphenotoin is safe and readily absorbed and can get to a loading dose within 30 to 60 minutes. Elderly patients or those with cardiac disease may not tolerate phenytoin as well as phenobarbital. Acute toxicity is more closely related to the infusion rate than to the total dose. Patients with possible complications may tolerate a greater dose in slower infusions. Purple glove syndrome is what happens when phenytoin is infused into tissue, when the IV is not patent and it infiltrates into the skin. You'll see in this picture the tan is painfully swollen and just discolored from the wrist down. Phenytoin has been linked to cases like this, causing pain, amputations, and can even lead to death. Oxcarbazepine is used for treating certain types of seizures in patients with epilepsy. It may be used alone or in combination with other medicines. It can reduce the sodium in the body to dangerously low levels, which can cause a life-threatening electrolyte imbalance. Patients who take this medication may be at increased risk of suicidal thoughts or actions, and the risk is greater in patients who had previously had suicidal thoughts or actions in the past. This can also cause a very bad skin reaction, Stevens-Johnson syndrome, which is a toxic epidermal necrosis, which can sometimes cause death. It is important to educate the patient to get emergency medical help if they have any signs of an allergic reaction, like hives, difficulty breathing, swelling of the face, lips, tongue, throat, red, swollen, blistered, or peeling skin with or without fever, red or irritated eyes, or sores in the mouth, throat, eyes, or nose. Levetiracetam is used for the treatment of epilepsy. It is a newer drug for treatment of partial seizures. The exact mechanism of action is not known, but it appears to slow down nerve transmission and inhibits abnormal firing without affecting normal neuronal excitability. It is used as adjunct therapy to treat partial and tonic-clonic seizures and is not metabolized by the liver. It has a low potential for drug interactions. Adverse effects would be decreases in red blood cells and white blood cells, paresthesia, pharyngitis, and can cause mood changes to quick anger. Families are usually the ones to ask to change to something else. Ethosuximide is thought to increase the seizure threshold in absence seizures. Ethosuximide is used mainly to treat absence seizures. Topiramate may prolong the blockade of sodium channels, enhance activity of GABA, and antagonize certain neurotransmitter receptors. It is excreted by the kidneys. The dosage must be decreased if it's renally impaired. Used in combination with other anticonvulsants to control tonic-clonic seizures, and also used for prevention of migraine headaches. Most common side effects include ataxia, drowsiness, dizziness, nausea, and renal stones. Lamotrigine is an anticonvulsant that acts on presynaptic sodium channels and inhibits the release of excitatory neurotransmitters, glutamate and aspartate. Is used to treat absence seizures, partial seizures, tonic-clonic seizures, and Lennox-Gastaut syndrome. Most often used for partial seizure, but can be given for tonic-clonic, absence, myoclonic, and atonic. Treatment with lamotrigine should be stopped if a rash occurs, unless it is clearly determined that the medication did not cause the rash. The rash can lead to a Stevens-Johnson syndrome, can also cause visual changes, ataxia, and drowsiness. Even if lamotrigine is stopped, a rash caused by it may still become life-threatening or other serious side effects like permanent scarring. Valproic acid works in the brain tissues to stop seizures. It is also used to treat the manic phase of bipolar disorder and helps prevent migraine headaches. It may cause some people to be agitated, irritable, or display other abnormal behaviors. It may also cause some people to have suicidal thoughts and tendencies or to become more depressed. This med may cause serious allergic reactions affecting multiple body organs like the liver or the kidney. Pancreatitis may even occur while taking this medication. Therapeutic level is 50 to 100. Side effects include drowsiness, nausea, vomiting, tremor, weight gain, transient hair loss, blood dyscrasia, hepatotoxicity, and pancreatitis. Vigabatrin is used alone or together with other medicines to treat complex partial seizures in adults and children 10 years of age. Vigabatrin is used alone or together with other medicines to treat complex partial seizures in adults and children 10 years of age and older and infantile spasms in children. It is used in patients who have already been treated with other medicines that did not work well. This medication may cause permanent vision loss, so it is important to educate the family to contact a physician immediately if their vision blurs, they have difficulty in reading, or any change in vision occurs during or after treatment. It's important to have drug levels on these three drugs. The Dilantin, 10 to 20 micrograms per ml, Carbamazepine, 3 to 14 micrograms per ml, and phenobarbital, 10 to 30 micrograms per ml. Another one to know would be Valproic acid, which is 50 to 100. Another item with phenobarbital is that it does have a long half-life and can take 2 to 3 weeks to reach therapeutic levels. As we discussed, several medications can cause a Stevens-Johnson rash, and this is a syndrome that is rare and a serious disorder of the skin and mucous membranes, and it is usually a reaction to a medication or an infection. Often, the Stevens-Johnson syndrome begins with flu-like symptoms, followed by a painful red or purple rash that spreads and blisters. Then the top layer of the affected skin dies and sheds. Stevens-Johnson syndrome is a medical emergency that requires hospitalization. Treatment focuses on eliminating the underlying cause, controlling symptoms, and minimizing complications. Recovery after Stevens-Johnson syndrome can take weeks to months, depending on the severity of the condition. If it was caused by a medication, then the patient will need to permanently avoid that drug and others closely related to it.